Hi there. I'm going to chat today about grey matter in the brain in relation to women going through the menopause. So, grey matter is full of little blood vessels. It's the part of the brain that kind of surrounds the outer aspect of the brain, and it also extends down our spinal cord. And the blood vessels are really important because what is good for your blood vessels, in particular, what's good for your heart, the blood vessels around your heart, is going to be good for your brain. So what happens to the grey matter as we go through the menopause? In this transition, the estrogen, as you know, is going down. For some women who are in the menopause because of medication they're on, maybe after chemotherapy for breast cancer, then the estrogen levels are going to be very, very low. And the receptors in the grey matter that are usually stimulated by estrogen are no longer stimulated. So we know there is a decrease in volume of grey matter. Grey matter is so important for decision making, a lot of emotional reactions. The synapses in there that use dopamine and serotonin are no longer going to be working just as well, and hence why you will have anxiety or depression at this time. Not everybody, some women will have that. It may be related to brain fog, one of those things that is really difficult to pinpoint, but perhaps is related to brain fog. So if you take HRT at this time, so estrogen replacement therapy, there is a maintaining of grey matter, but we don't know for sure if that is the case for every woman. And we do know, if you don't go on to HRT, that there are adaptations in the brain after the menopause that kind of make up for that dip. So it's not that you have to take HRT. And more studies will come out as women have been on this for longer. So maybe in 10 years, we'll be able to look back and say, yes, that preserved our cognitive sort of memory and executive function in the grey matter. And then we'll be able to advise women better. But if you're not taking HRT, what can we do to preserve and keep the grey matter healthy? So going back to the heart, what's good for the heart is going to be good for the grey matter because of all those blood vessels. We have blood vessels around the heart, blood vessels in the grey matter. So we are talking about blood pressure, cholesterol. You need to know both of these. You want a low blood pressure, you want a really good cholesterol profile, and you might have to work at that depending on your genes and your diet and your body weight and so on. We're looking at exercise, everybody knows that, but really timetabling it in if you are a busy woman who has a family, kids, the job, everything, you have got to prioritize your health and your exercise, okay? You have to do it. So there are exercise guidelines out there. Make it vigorous. You're going to have to do much less. You don't need to do those 300 minutes of aerobic exercise. If it's vigorous, you might get away with, a good hour of vigorous exercise a week. Strength training will help the heart, will help your bones and muscles and tendons if you're not on HRT, and you're going to feel better. So those serotonin hormones are going to be on the increase, on the rise. Then coming with that, we have stress reduction. So important, and we all probably have just this underlying low level of stress that we're just not even in tune with. And it depends on your setup. You may be so busy trying to provide for your family, trying to hold down a job. Maybe you're doing research to further your career. But at the end of the day, you need a strong platform to bounce off and to achieve whatever it is you're hoping to achieve in your life. So touching in with yourself every day, just checking in and asking yourself, how do I feel? How does my body feel at this moment? Is there stress in my shoulders? Do I feel it in my jaw? Do I feel it in the muscles at the front of the neck? Do I feel it in the back? Where do you hold your stress? And we all hold our stress somewhere in our body. And maybe doing a body scan at the end of the day, lying down. If you haven't done yoga, you can download or listen to a body scan on YouTube. I'll try maybe put one on the website as well. And scanning through the body, just relaxing, the neck, the head, the shoulders, piece by piece, part by part, and really sensing into your body. We become so disconnected from our bodies, and that's modern day living, and we are stuck in our mind that we don't even know what's going on in the rest of our body a lot of the time. So reducing stress, looking at your life, taking stock, and getting good sleep. So we have to prioritize sleep and trying to get outside in the morning. You hear it all the time, get out to the morning daylight, and it's not until you actually step outside and see the sunlight. I know there's not a lot of sun, but the daylight, and feel that and listen to the birds, that you realize you are almost trapped in your house overnight. So connecting with nature, you know, trying to get out even once a week and just taking your kids out with you and really getting out there and feeling a part of this beautiful planet that we live on and this beautiful universe. So I think I've covered most things there. Diet, we, I guess, know about that too. You know, trying to just eat mindfully. Chewing your food increases the number of neurons that you will make in the brain. We can still make neurons even as we age, which I was surprised to learn some years ago. Chewing your food, so vegetables, hard vegetables, nuts and seeds will help with the neurons. Taking a little bit of zinc, we know it pushes copper and iron out of the body, but a little bit of zinc maybe for 3 months of the year, 15 milligrams, can help with neuronal function, as does the exercise that I've mentioned. So this is a transition for everyone in the menopause, and you know, it's a time to take stock of your life, and you know, as you embody the wisdom that comes with aging, and you know, maybe you can share this information with your kids if you have daughters as well. Okay, if you have any questions, you can put a question in the comment and I will get to it at some point. It might not be immediate. I think that's all I have to say. Have a lovely day. Bye.